Lockdowns may be a thing of the past, but the effects of the pandemic are starting to show in other ways.
College students are back to in-person classes for the first time in a year and a half. However, going back to normal is harder than some might have expected. NAZ Today's Lacey Fraun is here to explain.
Yep, that's right. Now that most students are back in the classroom, the demand for mental health support is rising. NAU student athlete Taryn O'Neill is the top runner for the women's cross-country team. She was one of the many students who went from online classes to back in the classroom. And it hasn't been easy.
It has just been like a bit tough transitioning back, especially with fully in person.
O'Neill says the transition felt abrupt. Suddenly, she was juggling sports, academics, social life, the pandemic, and her mental health.
Like that is definitely a downside of this semester. Learning face-to-face is beneficial for a lot of people, but it can also be like quite daunting, especially after not having done that for an entire year and a half.
Some students haven't gone back to fully in-person classes. ASNAU President Maylee Acosta is one of the many who have found a way to stay out of the classroom.
Most of my classes are still online. I only have one in-person class. Yeah, kind of has felt the same to me as the COVID year.
Acosta says some of the measures taken to ease the stress during the pandemic, like student mental health days, might be worth keeping around.
ASNAU passed a resolution last semester requesting the faculty to consider mental health days. I know a lot of faculty have really been implementing that.
NAU's Mental Health Services has been busy since before the pandemic, and they continue to see a demand.
I know that a place that we're struggling is in the counseling services that we have on campus. Those have been highly requested, and there aren't enough staff to talk to all the students that need that guidance.
Arizona's jobless rate is at 6.7%, which is slightly above the national average. The question remains, how does NAU plan to meet the increased demand for mental health resources with such a low supply of workers? We are waiting for NAU Mental Health Services to comment on the matter, but the CDC provides tips on their website on how to reach out for help and how to cope with stress, anxiety, and isolation. Lacey Fraun, NAZ Today.